Candida auris is a yeast known as a superbug because it is resistant to many antifungal drugs commonly used to treat Candida infections. It is also difficult to identify with standard lab methods and can be misidentified, leading to inappropriate management or treatment. This yeast can cause bloodstream, wound, and ear infections. Those at the most risk for infection are the immunocompromised, recent hospital patients, people spending time in nursing homes, and those with lines or tubes that go into their bodies. Candida auris was first identified in 2009 in Japan from an ear swab, but the earliest known strain dates back to 1996 in South Korea.
This disease, Candida auris, spreads mostly through human migration and incomplete sterilization of medical equipment. It is likely that transmission between countries involves the movement of infected individuals who do not know they are infected. The most important forms of transmission, however, involve the spread of the fungus to patients and between hospitals via infected equipment. This fungus combines the extreme environmental persistence of other Candida species with extreme resistance to common antifungals, ensuring that items like catheters and sheets remain contaminated even through routine disinfection.
In the United States, as many as 587 clinical cases of C. auris have been confirmed as of February 28, 2019, and as many as 1,056 patients in the United States have been found to be colonized by C. auris. The states afflicted include California, Texas, Florida, Virginia, Oklahoma, Connecticut, Indiana, Maryland, Massachusetts, and with the highest number of cases in New York, Illinois, and New Jersey. As of 2019, more than 30 countries have had single or multiple cases. And many of the United States cases have been linked to patients staying in hospitals in other countries and then returning to the States. Control of C. auris is vital to stop the spreading of this fungus and to prevent further infections in other countries and states.
Early identification of C. auris, although difficult, is key to containing the outbreak. Through in-depth procedures, 2 separate hospitals in Oklahoma were able to prevent any hospital-related infections among other patients or staff. For healthcare workers in contact with patients infected with C. auris, proper hand washing, sanitation, and glove protocol should be followed. Hospital-grade disinfectants will need to be used to properly clean and disinfect the patient's room during and after their occupancy. This should be done daily and include any shared spaces or equipment before being used by another patient. If you're visiting someone infected with C. auris in a healthcare facility, wash your hands carefully and frequently. If you're going to be there often, you might want to consider wiping surfaces around you down with bleach every now and then. Additional precautions for specific settings such as nursing homes, dialysis centers, and general clinics can be found on the CDC website.